Hi, my name is Steve Hayes, and this is part of a series that we're doing on acceptance and commitment therapy, relational frame theory, and contextual behavioral science. The expert that we have working with us today is Louise McHugh, who's at Swansea University as part of the Irish Mafia, the folks really who have done, I think, really the bulk of the heavy lifting in trying to establish relational frame theory as a viable research program in human language and cognition from a contextual behavioral point of view. Louise is not a clinical psychologist, but has done work in linking relational frame theory not just to clinical topics, but to other topics of importance and implied importance that are not necessarily those that you'd be expecting to see inside behavior analysis. So she's built some bridges between this work and some of the places that you'd want to take a relatively adequate theory of language and cognition if it was doing its work. So there's it's an important body of work that, and I think some of the most important work going on that her lab represents. By way of orientation to those who may be seeing this on the web, this is a part of a seminar. You'll meet the students as we go around and ask some questions. But our experts are asked to hold forth for a period of time, and then we'll get into questions and answers. This is being done in the spring of 2010. And so with that orientation, thanks to you, Louise, for being part of our little exercise. I'll turn this over to you, and after you have your comments, then we'll get back to the people in the room and their questions. So thanks for doing this. Let me just turn the microphone over to you.
Okay, so what I'm going to look at is primarily some research that's been conducted in our lab at Swansea that links RFT and ACT together. And I'm going to try and look at how those links actually link into key processes in acceptance and commitment therapy. So primarily, first of all, I know you've had the Foxy Learning tutorial, but I'm just going to briefly recap on relational frame theory, and then going to move into looking at sort of the perspective-taking research and how that links into self as context and mindfulness briefly, and then look at the self and perspective-taking and how RFT looks at that. And then I'm just going to finally look at how RFT accounts for a coping strategy that doesn't work, and that is thought suppression, and why that doesn't work, and then just present acceptance as an alternative. So just to start off, really the RFT ACT link is fundamental to the development and refinement of ACT, and to the success of ACT as a treatment package that's grounded in basic behavioural theory. So relational frame theory asserts that the core of human language and cognition is generalised contextually controlled relational responding, which is a bit of a mouthful. It's otherwise known as arbitrarily applicable relational responding or relational framing. So just to look at what the core properties of relational framing or frames are. If I was to tell you that Nahar is the Irish for snake, or Nahar is the same as snake, you would mutually entail the relation that snake and Nahar are the same as each other. And if I was to tell you that Nahar is the same as Slanga, you would mutually entail the relation that Slanga is the same as Nahar. Then interestingly, you would also form the combinatorial relation between Slanga and snake without ever having been directly trained in this relation. And even more interestingly to psychologists, then if you were scared of snakes, in the future, on hearing "here comes a slanga," the fear functions that you've previously learned and attached to snake would then be evoked. So to just make this, the idea of relational frame theory a bit more clear, I'm just going to look at the distinction between non-arbitrary relational responding and arbitrary relational responding. So if I was to ask you, to select the bigger than of these three comparisons in the presence of this sample, or the smaller than, you'll be able to do this with relative ease, based on the physical or formal properties of the actual stimuli. So it's actually bigger, it's actually smaller than the sample. However, with arbitrarily applicable relational responding, if I presented you with the following sample and these three comparisons, if I asked you to select the bigger than or smaller than, in this case, you would be unable to do it because they're all physically the same size, unless I provided you with some clues or contextual cues, such as red is greater than yellow and red is less than purple. In which case, then you would be able to select the bigger than red, which would be purple, and the smaller than red, which would be yellow, based on these contextual cues. So arbitrarily applicable relational responding involves responding to relations between stimuli that are not based on the physical properties or the physical relations, but on contextual cues. So just to look at an empirical demonstration of derived stimulus relations and the transformation of stimulus functions that Dore et al. Conducted. They got 15 normal subjects and they put them into two separate groups. And they gave them relational training that A is less than B and B is less than C. And then they trained the participants that in the presence of B they received an electric shock, and in the presence of the A stimulus they got a half the strength shock that they got in the presence of the B stimulus. And then what they did is they tested participants' skin conductance to the C stimulus. So what we see here is the skin conductance level of the participants relative to the B stimulus, B being at 0 here. And for the red, we see the group that had the relational training. And here what we see is the predicted emergent performance, in that to the derived, or to the C stimulus, we see a greatly increased skin conductance response or fear response attached to it. Okay, so that's the core properties of relational framing. But how exactly do we come to learn how to arbitrarily relationally respond? So if we just look at the first example, or the primarily first trained type of relational response, which involves the name-object-name relational responding. Children are exposed to masses of explicit training in both of the unidirections of this type of bidirectional relation. So through examples like in the presence of a stimulus, a parent might ask the child the word object relation, such as where is the ball? And if the child points or orients towards the appropriate stimulus, the parent would provide them with corrective feedback and reinforcement. The parent would also train the child in the unidirectional object spoken word relation, such that in the presence of the stimulus, the parent will say, what is that? And then if the child makes an appropriate verbal response, the parent will give them corrective feedback, well done, etc. So here what we see is that is acting as a contextual relation or a contextual cue for name-object, object-name responding. So, in other words, what we see here is that through thousands of exemplars or masses of bidirectional training that's involved in this type of parental naming game, this allows the child to derive the unthought mutually entailed symmetrical relation from an object to a name without being explicitly trained to do so. So essentially, after thousands of examples have been trained in both of the unidirections, a parent could then say to the child, this is a pencil, and in the future the child will be able to respond when asked, what is this pencil, correctly, without ever having to actually be directly trained in the unidirectional, in both unidirectional relations. So in effect, the word is, and the naming context more generally, will bring the relational frame of coordination or sameness to bear on these novel object pairs. Okay, so that gives us an example of how these mutually entailed relations are learned. And just to show how a competent word relation might be learned, if we explicitly train children to many exemplars, just one exemplar might be television is the same as telly, and telly is the same as TV. Then we can also train them that TV is the same as television. Well, after thousands of examples of getting this type of training, in the future, if you trained a child that dog is the same as mutt and mutt is the same as hound, then you will be able to test them and they will be able to respond that hound is the same as dog. So according to relational frame theory, there's a number of different types of families of frames apart from sameness. And we saw one there when we saw comparative frames of more than and less than. But there's also relations of difference, of hierarchy, and also of perspective or dyactic relations. And I'm going to just zone in a bit on perspective relational frames for this part of the talk. And the research has been done there. And just before I do that, perspective taking and the sense of self are actually linked to probably a lot of the areas of the hexaflex, but two areas that they're very important for is the development of a self as context and sort of that mindfulness sense or contact with the present moment. So perspective taking from the RFT point of view involves three dyactic relations: interpersonal relationship between I versus you, spatial relations of here, there, and temporal relations of now, then. Okay, so taking the perspective of another is one of the most critical developmental skills, and in the mainstream literature it's commonly referred to as having a theory of mind. From the relational frame theory perspective, what's involved in taking the perspective of another is complex contextual control of a specific family of relational frames, and this family of relational frames is called dyactic relational frames. So dyactic relational frames are frames that are a way of relating that specifies a relation in terms of the perspective of the speaker. So again, consider the frames of I versus you, here versus there, and now versus then. So each time that we ask or answer questions like these, so what am I doing now, what were you doing there, although the physical environment or the context will be different, and what's going to remain constant across all these questions is going to be this I here now, or I versus you, here versus there, and now versus then. So I is always going to be from this perspective here and now, and not from someone else's perspective there and then. So a sense of perspective is therefore abstracted to learning to talk about one's own perspective in relation to other perspectives. It feels quite unusual to be talking about perspective taking when I can't see anyone's face that I'm actually talking to, but okay. So from the RFT perspective, there's two important variables involved in development of perspective taking skills. So firstly, the varying relation types that we looked at there, I, you, here, there, and now, then. And then also varying levels of complexity with these relational dyactic frames is involved. So just to give you an example of the types of levels of complexity and tasks that might be used from a relational frame theory point of view in taking the perspective of another or testing for and training the perspective of another. So a simple relation might go as follows. I have a white brick and you have a red brick. Which brick do you have? The correct response is red brick. And which brick do I have? The correct response is white brick. And we could put in emotions into these types of tasks as well. And we'd see a transformation of the emotional functions through these frames. So, well, maybe in the reverse task, I'll look at that. So imagine in a reverse relation, we might say, I'm sitting here on the blue chair and you're sitting there on the black chair. If here was there and there was here, where would I be sitting? I'd be sitting on the black chair. And where would you be sitting? You'd be sitting on the blue chair. And then in a double reverse relational task, might go as follows. Yesterday I was sitting there on the blue chair. Today I'm sitting here on the, yesterday I was sitting there on the black chair. Today I'm sitting here on the blue chair. So if here was there and there was here, and if now was then and then was now, where would I be sitting now? I'd be sitting on the blue chair. whereas I was sitting on the black chair. Okay, so I'm just going to look at 3 of the studies, but there's been quite a few studies in this area, briefly. The first of these studies looked to see if there was a relationship between, in the mainstream theory of mind performance, and those type of vignette-like story tasks, and responding in accordance with these didactic frames, or these types of tasks. So 5 different age groups were exposed to a relational protocol of those tasks that manipulated both relation type and complexity, and a protocol of 66 tasks. And what we saw was that the early childhood group, or the 3 to 5 year olds, which would be where the critical shift in theory of mind would occur, did appear to have significantly more errors than the other groups. Also, Tim Weil conducted a study where he used a multiple probe design in order to see if training in this relational protocol for subjects who were pre-experimentally deficient, and this is one subject's data, if training them in simple reversed and double reversed relations actually made a difference in terms of theory of mind performance. And here in this participant, we see that after the training of simple reversed and double reversed relations across these tasks, that the participant's performance on theory of mind task is improved. So it looks like these are overlapping or looking at similar types of processes. And then there's another study in the area of perspective taking. Matthew looked at or conducted the perspective taking protocol with a group of schizophrenic patients and controls. And here we see in the white bars we see the white bars we see the experimental patients, and we can see that for this group of patients, and those diagnosed with schizophrenia are reported to have perspective takings deficits in perspective taking. And what we can see here is that they are showing the significantly poorer performances on reversed relations and double reversed relations, even after controlling for IQ, than the controls. Okay, so that's just a brief cut through the perspective taking, some of the perspective taking studies in the area. And now I'm just going to slide into some studies with the RFT and the self. So according to Skinner, the self is a social phenomenon, and it's only when a person's private world becomes important to others that it's important to him. So he sees it as a process of discrimination that results from questions such as, where are you going? What are you doing? How do you feel? And in order to actually be able to satisfactorily respond to these questions, we must discriminate ourselves from other events in the environment. Okay, so Diamond and Barnes attempted to modelled the verbal discrimination of self-behaviour, with verbal being in terms of deriving stimulus relations, if you like. So what they did was they trained participants in three-member equivalence classes. And then in phase 2, what they got participants to do was they put them into what they referred to as a spacebar task. And so spacebar task appeared on the screen. And then participants had to either press the spacebar or either they didn't press. After which the presentation of both the B1 and the B2 stimulus appeared on the screen, and the participants had to select either B1 or B2, and they got feedback for selecting B1 or B2 based on whether they had pressed the spacebar before the presentation of B1 and B2, which meant that they would have to select B1, and if they didn't press the spacebar before the presentation of B1 and B2, they had to press select B2. So they were self-discriminating whether they pressed the spacebar or not, or discriminating. And then what Diamond and Barnes did is they tested in the presence, they tested pressing or not pressing, and then they asked them to respond as to whether that was a C1 or C2 response. So they saw the derived transfer of self-discrimination functions. In 1995, Diamond and Barnes also were able to demonstrate this across comparative relations, or same, opposite, and more or less relations. So what they did here was they trained participants that A1 and B1 A1 was the same as B1, that A1 was the same as C1, and that A1 was less than B2, and A1 was more than C2. Then what they did was they trained the response function of pressing one response to the B1 stimulus, and then they tested responding on B2, C1 and C2. And what they expected to see, and actually did see and demonstrate, was that on the B2 stimulus there was no response. On the C1 stimulus there should be one response, and on the C2 stimulus they saw two responses. Just thus demonstrating the transformation of self-discrimination response functions via these comparative relations. Okay. So why is that important? If we can model sort of the generativity or the derived transfer of these types of self-discrimination or self-discrimination of our own behaviour, this could lead to yesterday I didn't call my mother, so today I'm thinking I'm a bad person. And this type of generalised content might start to emerge through this. So statement in the here and now about I in the there and then, such as I'm insensitive and selfish because I didn't call my mother on her birthday. What we see is that these evaluative terms could enter into a frame of coordination with I, the self, and the functions of insensitive and selfish can then transfer to I. So self as content is all the descriptive and evaluative statements that we make about I. So most clients will come into therapy with very low self-concept. So what they're showing is a very negative self-content. And they're also seeing self-evaluations to be literally true. So they're believing this negative content. So as a result, they almost see themselves as needing to change. So then the type of network that might cascade out of this might be I might directly be told I'm stupid, then I might start to derive I'm nothing but trouble, I'm bad, everyone laughs at me, no one loves me, I'm worthless, unworthy of affection or trust of others, must avoid intimacy, then feelings of loneliness, a lonely, sad individual. Okay, this type of cascading network can emerge. And this doesn't just have to happen with negative evaluative statements about sort of, well, they're linked to really self-worth there, but it could also occur in the way we judge our effectiveness or our self-effectiveness on a task. So imagine if you fail at an exam early on in life, and you might think you're bad at exams, you might avoid situations that would involve exams, you might not go and get a good education because you think it's going to avoid exams, etc. So Charlotte Dack, in one of the PhD students in Swansea, who just actually defended and is Dr. Dack now, wanted to look at the derived generalization of self or causal efficacy judgments in her PhD. So she did that. So in anxiety and depression and phobias, certain types of evaluations about the areas of one's life or a person's life can be acquired through evaluative conditioning. And experimentally, different ratings of self-efficacy or causal effectiveness have been produced through exposure to various conditions in which the relationship between an action and an outcome is manipulated. So different schedules of reinforcement. So Reid in 2001 showed that schedules of reinforcement are a determinant of both response rate and causal judgments. So what they showed that on a VR schedule, a variable ratio schedule, where the action-outcome relationship is strong, this produced high rates of self-efficacy and high rates of response. Whereas on a variable interval schedule, the action-outcome relationship is weak, which produces low rates of self-efficacy and low rates of response. So where does derived stimulus relations come in? Okay, so the extent to which such evaluations generalise across many circumstances is prevalent in, or a high extent is prevalent in clinical disorders. It's very unlikely that these negative evaluative judgments are all a result of direct learning. So in order to determine how how these self-evaluations generalise across so many different contexts of a person's life, it seems like derived stimulus relations might be able to provide us with a behavioural account of that. So the aims of, I'm just going to look at experiment 1 of Charlotte's work in this, from this paper. But she aimed to look at whether evaluative judgments produced as a result of exposure to various conditions could transfer to stimuli present during training, and then whether such judgments could generalize through derived relational networks. Okay, so 15 participants undertook the task. I'll just go to each part of the procedure. Firstly, participants were trained on 2 3-member equivalence classes. So the words useless and good were directly trained into the classes as the C stimuli. Okay. And then emergent relations were tested for, and the mastery criterion on this was set at 83% or higher. So the evaluative conditioning task involved, in the presence of the yellow circle, participants were exposed to the differential reinforcement of high rate behaviour, and in the presence of the blue circle, participants were exposed to the differential reinforcement of low rate behaviour. So we should be seeing that participants, based on what Reid found, that participants in the high rate of behaviour are going to rate themselves as more effective than on the low. Okay, the low DRL. So participants then received 4 2-minute exposures to each condition. And then after each of the condition, they were asked to rate how effective their spacebar pressing was at gaining points on a scale of 1 to 10. So then in the transfer function test, each of the words from the classes were presented at the top of the screen, and participants had to select either the discriminative stimulus for the DRH or the discriminative stimulus for the DRL. And then each stimulus was presented 4 times with a total of 24 trials. So if we just look at the efficacy ratings, so the causal efficacy ratings, we see the predicted performance in the sense that across the 4 trials, participants rated themselves as more effective on the DRH than on the DRL. For the transfer function test, 11 of the 15 participants performed in the predicted direction. So the colour that signalled high rate behaviour or high causal efficacy was selected in the presence of the stimuli related to good, and then vice versa for the low efficacy condition. And we compared the transfer scores to chance. Actually, that's not what's reported in the paper, but we did compare them to chance, and it was significantly different. So then again, if we just look at the efficacy ratings, or if we look at the efficacy ratings in the transfer function questionnaire that came later, we see that the participants were engaging in the predicted performances. So in the sense that when looking at the A stimuli for the useless class, participants were rating the A stimuli very low, B stimuli very low for that class, and even the DRL colour that was associated with the or the colour associated with the DRL was also been rated as closer to useless than good. So the use of the different schedules produced different ratings in efficacy, and also led to a transfer of evaluative learning across a number of stimuli using derived relations. So in a sense, what this is giving us is some idea of how self as content, or the content that we get fused with, can start to generalize across an array of situations or stimuli. So from the ACT perspective, self as content is sort of a target process because of the fact that fusion with these types of negative thoughts and the way that they can generalize so readily can cause problems for patients and, well, humans in general with language. So in a sense, what ACT is trying to foster is a self of context that gives a bit of space or comprehensive distancing from this type of content that participants are fused with. So the self as context is a bit like, to self as content is a bit like a house is to furniture. So once the ability to take perspective emerges, it then becomes an inherent property of most verbal events. So then all experiences are had in the I, here and now. So we can have experiences about the there and then, but they're had in the here and now. So then talking with others is always by the I in the here and now about events in the there and then. So thus the I in the here and now is consistent across all experiences. It is an unchanging and transcendent aspect of all experience, regardless of the content of the experience. So wherever you go, there you are. And this is the self as context. It's important therapeutically because it helps clients to distinguish themselves from their content and sort of provides a safe, unchanging perspective from which to experience events. Okay, so then if we just look at fusion and diffusion. So fusion from the ACT perspective is when we are caught in the self as content and self as process, I feel so worthless right now, or I'm a worthless person, rather than being able to take the perspective as self as context, such as I'm having the thought that I am worthless, or I'm having the feeling that I'm worthless right now. And being able to take that step back from this fused space is seen as diffusion. So, when we respond to our thoughts as I hear now, we are in a sense caught up in them. We are not perceiving those thoughts and feelings from a perspective, but rather they are the only perspective or the perspective. But however, when we respond to our thoughts and feelings as I there then, they are seen as thoughts and feelings that we had rather than providing our current and only perspective. So from the RFT point of view, an important part of therapy, including homework exercises, involves extensive exemplar training in the appropriate transformations of relational functions, such that the typical avoidance controlling properties of negative thoughts and feelings are somewhat reduced. So then, in a study by Roach et al. That's under review, these researchers wanted to model diffusion. So what they did in order to model this empirically was to randomise participants into a diffusion or a non-diffusion groups. And then they got them to read 50 positive and 50 negative statements for both the A1 and A2 stimuli. So what they were attempting to do was to undermine the coherence of language by loading the A1 and A2 stimuli with a number of different incoherent statements about them. So imagine A1 was mu, then the statements would look like mu is fantastic, mu is excellent, mu is terrible, mu is hideous, etc. Then they basically trained the participants to relate the A1, the mu, and the A2, which was, say, path, into two different equivalence classes. Okay. I'm going through this gradually. So phase one was this emotional flexibility training, where subjects were required to make observation responses to a series of both positive and negative statements regarding a range of nonsense syllables. Then they got the equivalence training. And then they were put into an avoidance phase. And this is where A1 was presented and they had the opportunity to not go in to see a picture by pressing the space bar on the computer. If they didn't press the space bar, they would have been presented with an aversive image always for A1. And when A2 was presented on the screen, after it, they would have been presented with a pleasant image. Okay, and then the test for the transfer avoidance wanted to examine the possibility that subjects would produce a derived avoidance response. So we should see that they would not only start to avoid responding to A1, which has been directly trained to have aversive images behind it, but also they might start to avoid the C1 stimulus that have been trained in equivalence class with that A1. Okay, so in the test for avoidance phase, they were presented with just the C1 and the C2 stimuli, but actually no pictures or images actually followed the presentation of these stimuli. And again, just a summary of what the phases the participants went through. So in the first instance, if we look at the probability of trained avoidance, so, you know, in both the diffusion and the no diffusion group, participants were equally likely to avoid the A1 stimulus, which was directly followed by a negative image. But what did emerge was that in the diffusion group, participants were much less likely, and this is the group where they had to read all these statements where they sort of broke down the verbal coherence of what the word mu actually meant. That participants were much less likely to avoid, in the diffusion group, the C1 stimulus. So that's an experimental model of diffusion in the lab. So having just looked quickly through some of the perspective-taking research and the research on the self, the last thing I'm going to look at is how relational frame theory can account for when coping strategies may not work, such as attempting to suppress thoughts. First of all, I'm just going to say why it might be that we might attempt experiential avoidance, or thought suppression being one form of that. Well, because we have language, and because of these relational processes and the transformation of stimulus functions, we can have self-awareness of a painful history, compare ourselves to a deal, knowledge of time and of death, prediction of pain, and being able to review the unchangeable past. So language can create a lot of reasons why we might want to avoid certain things and thoughts. So what ACT aims to do is to undermine experiential avoidance and increase willingness, and to decrease cognitive fusion and increase mindful awareness. So sort of change the context in which we are languaging. So understand the way language works, combat the negative effects of language, and amplify the positive effects of language. So one of the negative effects of language is thought suppression. So with thought suppression, private events become psychologically present, and they have aversive functions to relational frames. So the thought that I will die might have aversive functions. And then such private events are targeted verbally for change, same way we might decide that we want to remove external objects, such as I don't like my couch, I'm going to get rid of it. Well, then when bad psychological content shows up as a psychological event, we might try to get rid of it or squash it down in the same way. Okay, so a person thinking about death might then try to think about something else, such as sitting by a lake. Okay, so the negative effects of thought suppression are sort of, twofold. Firstly, the outcome of rule-gum behaviour usually needs to be evaluated, but in order to do that, we actually have to check that we're doing it appropriately. So the attempt to actually successfully suppress becomes very, very difficult, because in order to know that we're doing it, we have to recontact the actual item we want to suppress. And thought suppression is also problematic because attempting to suppress your thoughts strengthens the context of fusion. So in that, when thoughts of death are avoided, this strengthens the behaviour regulatory effects of the verbal stimulus death, and makes it even less likely in the future that this thought might be observed as just merely verbal responding. So the way RFT would look at thought suppression is that thinking is part of our repertoire of learned behaviour, covert responding, which produces thoughts, which then become stimuli for further covert responding, and then thought suppression is an attempt to respond away from certain thought stimuli when they arise, and thought suppression fails when the person responds to that thought rather than responding away. So what Nick Hooper did then was to look at the derived of thought suppression through derived stimulus relations. So Nick recruited 30 participants, and they were put into one of two conditions, either the suppression condition or the instruction condition. So the methodology went as follows. First of all, participants were given some screening measures that might be related to high levels of thought suppression pre-experimentally, such as the White Bear Suppression Inventory or the AAQ. Then participants were exposed to equivalence training and testing. They were trained and tested for 3-member equivalence classes. Then participants were put into in the White Bear literature, or in Wegener's paradigm, a 5-minute suppression period where they had to suppress all thoughts of the word bear. And then they were also given an induction of cognitive load, so they had to remember a 6-digit number for the remainder of the experiment, which is common in the cognitive thought suppression studies. And then they were presented with the avoidance program. So, just first. So, in the formation of the equivalence class, Bear was trained as related to Boseem and to Gidir. So then derived relations would emerge between Boseem and Bear, Gidir and Boseem, and then the convoluted word relation would occur between Bear and Gidir. So Gidir is of particular interest here in terms of how the participants will later respond to this item. Also in this study we wanted to look at contextual control. So Wolford and Hayes have previously shown that the way that different stimuli or the functions transfer can differ depending on context. We wanted to show that it wasn't going to be that the avoidance response to Bear was just going to generalise across even when they weren't given a suppression instruction. So what we did was participants in the avoidance phase were put in, either they were told don't think of a white bear but remove any word that reminds you of or interferes with your suppression attempt. Then what participants were exposed to was a presentation of Bear, the related items, and also novel words that were all presented on the screen. Each word would stay on the screen for 10 seconds if it wasn't removed by means of spacebar pressing by the participants. So what we saw was that in the group that was told to don't think about Bear, suppress all thoughts of Bear, the participants removed both Bear and Gidir as they were interfering with their suppression attempt, but not the unrelated items. However, in a control group, participants were asked to remove just the word Bear from the screen, and they didn't remove the related item or related Gidir. So what we're seeing is a transformation of stimulus functions, and we're also seeing a contextual control on that transformation of stimulus function. It wasn't just simply in any context in which a response to Bear was required that the related items were also removed. So in a sense, what we end up with is people in a situation like this. Once you try to suppress one thought, I'm going to throw this out there. This is a study that we have just looked at some data for. So it's very similar to the initial Hooper et al. Study. But what we wanted to do is we wanted to see if we could get at sort of how thought suppression can affect, and generalised thought suppression can affect performance or preferences and selections towards certain preferences or choices that we might make. So what we did was we asked participants initially to make a selection between these two doors, a red door and a blue door. And to select the red door, they had to click Q. To select the blue door, they had to click P. When they made a click, the door opened and then it closed again. Then what participants did was, after 10 trials, they were stopped and then they were put through the equivalence training and the 5-minute suppression period that they had been put through in the Hooper study. Then what happened was the participants were recycled into this preference selection task or door selection task. And this time, whichever door that they had a higher preference for in the first 10 trials, then the target word Bear was presented behind that door, and also novel words. But the target was never presented behind the unpreferred door. Okay, so imagine they previously preferred blue, sometimes Bear would start to now occur behind blue. So they're asked to suppress all thoughts of Bear, but sometimes now Bear is actually occurring behind the unpreferred door. So we just analysed this data in the last couple of days, so I'm sure there's loads of things we're going to change about this. But in the first instance, what we're seeing here, when we just in experiment 1 looked at the target item, we see in the first phase, people had, on average, selected a preferred door 7 times out of 10. And then across 50 choices in the second part of the experiment, after the suppression instruction, we see that participants' selections of their preferred door started to drop off across time because the presentation of the word Bear or the target item to be suppressed was occurring behind the door. We also in experiment 2 did this just for derived items. So we just behind the door, the previously preferred door, in this case, we presented Gidir. And what we see is a similar pattern in that the previously preferred door is becoming much less preferred. So constriction in terms of previously preferred choice is been seen in attempting to suppress these items and even items related to the target stimulus. Okay. So the alternative to thought suppression is acceptance. And just to sort of wrap up with positing what relational frame theory would say about acceptance. Well, acceptance is not a technical term, but it's useful in the sense that it serves to orient us towards an important domain in understanding the treatment of human suffering. So in terms of the relational frame theory perspective, when acceptance is stripped down, it can involve the four of the following. So firstly, it involves a rule or a relational network in which a possibly aversive event is made contingent on a behaviour. So if I go to the mall, I would feel panicky. Second, it involves an action that then brings the individual into contact with that aversive event, going to the mall. Third, it involves the construction of a relational network that coordinates with that contact. So I'm at the mall and I feel panicky. And then fourth, there's a frame of coordination occurring between this network and the original rule. So I was right, I said I would feel panicky, and I did. So from the RFT point of view, it's point 4 that plays an important role in the efficacy of acceptance-based strategies, because what we see here is the coherence of two verbal networks, and relational coherence has a very high probability of reinforcement within the social verbal community. So the likelihood of following that acceptance-based strategy in the future is increased. Okay. So then just to wrap up, so the basic and applied sciences of behaviour analysis have been transformed potentially by the modern research agenda in human language and cognition, focusing on RFT. But a more complete analysis and understanding of human pathology requires that we deal with relational frames, relational networks, relations, perspective taking, and looking at the concept of self, and I suppose continued empirical development of these. Okay.